Good lady from District 18.
Thank you, Mr. Speaker. To debate against the bill.
You have the floor.
Medicaid expansion itself, I think Proposition 2 was one of the most well and thoroughly analyzed pieces of policy that has ever gone through in this state. Over 7 years, this was discussed really ad nauseum. I believe the governor convened 3 different groups that pulled together all of the experts across the state, and they all concluded, I believe unanimously, that we should pursue clean Medicaid expansion. It was passed by the voters at 61%. There was a thorough independent actuarial analysis done over the course of months by the Milliman organization that came out with very thorough, well-vetted numbers. In contrast to that, House Bill 277 is possibly the most half-baked thing I have seen in 5 years in this body. And I just want to walk you through a little bit of what I've seen this week. This bill was first introduced on Monday in committee. It was the first time we saw it with a recycled fiscal note that was clearly inaccurate. It had been used from a previous bill. We convened a meeting with the heads of health and welfare on Tuesday to try to understand what the bill really did. They were still scrambling. They had been working through the night trying to figure out what this bill actually did, how much it cost to whom, how many people would be kicked off their health insurance, and they were still working on it, trying as best they could to pull together the numbers that they could. We walked into hearing yesterday, the day that the bill was being heard and voted on, and we had a brand new note waiting for us in our folder that indicated it appeared to be a $7 million fiscal impact to the state. But when we asked the sponsor, he couldn't really explain anything on it and thought that that probably wasn't accurate. We asked those on those from the Health and Welfare Department what that fiscal note meant. We couldn't really get any explanation, and they were charged with going back to do some more research and try to figure out what this bill actually does. And then we came to the floor today. And it passed, by the way, with no recommendation. This did not come to the floor with a do pass. It came with no recommendation, which is important to keep in mind. Then it came to the floor today, and we have a brand new analysis that shows something in the neighborhood of, I don't know, $3.7 million cost. Still doesn't include any of the cost to counties of all the people that are going to be added to the gap. There was no time to do any of that analysis and figure out what this is going to cost to counties, to hospitals, to the indigent fund, to the CAT fund, et cetera. So just from the outset, from a procedural perspective, it's kind of stunning to me that we're looking to upend the most thoroughly vetted piece of policy over the course of 7 years, and we're going to replace that with this totally half-baked scheme, if you will, that came to us, and we still have no reliable fiscal information on it. At least what we have has come in the past hour. And then, of course, compounding that is that this has been pushed through with a use of supermajority power, suspending all rules to give any reasonable time for analysis of preparation. So the Speaker aptly noted when we opened this debate that this is an incredibly important issue. And it is, which is why I'm particularly flabbergasted that we're proceeding in the manner we are, that we're going to throw 7 years of work by experts out the window in favor of something that was hatched 48 hours ago and on which we have absolutely no reliable fiscal information. And overturning something that has been overwhelmingly approved by voters, 61% of voters. So just as a basic procedural matter, I would urge you all not to go down this path. I think this is the furthest thing we could do from trying to give citizens confidence in their government. But let's look at the substance of what this bill actually does. And in terms of, there's been talk of a secondary gap, because unquestionably, that's what this bill does. It creates a secondary gap. And I'm going to break that down for you, because I believe that secondary gap is approximately 22,000 people. And I'll tell you how I got to that number. You have the people over 100% of federal poverty level. There are approximately 14,000 people right now who are 100 to 138 of federal poverty who are not on the exchange. You could say maybe they could get on the exchange, maybe they could, but they're not. And they're showing up at hospitals and they can't pay their bills. And it's putting our rural hospitals out of business, and it's costing our taxpayers a ton of money, and it's costing ratepayers a ton of money. All 14,000 of those people are still going to be in the gap going forward under this bill. They would not under Medicaid expansion, under Proposition 2, they'd all be covered. They'd all be covered with a 90-10 match by the federal government. Under House Bill 277, none of them are going to be covered, and we are going to be eating the cost at 100% with no federal match. So we're starting with a baseline gap of 14,000. Add to that, we haven't even gotten to work requirements yet. Now let's look at work requirements and the people that are going to be hit by that are under the 100% FPL level. The work requirements that we have basically parallel Arkansas's, and it's been mentioned that Arkansas's work requirements resulted in about 87% of people not complying. Most of those people actually were working. They were just messing up their paperwork and failing to get it in on time. So we heard yesterday from Health and Welfare that when you look at that population and the people that are likely to be knocked off of Medicaid because of those work requirements, whether they're not meeting the work or whether they're not meeting the paperwork or whatever, that's going to be very conservatively 6,000 people and probably well above that. And that's assuming we do a lot better than Arkansas, actually. So all of that gets us to a new gap population of 20 to 22,000 people. And not only that, we're going to be paying $3 to $4 million to do it. So we're going to be adding $3 to $4 million to the cost of Medicaid expansion so that we can guarantee a new gap of 20 to 22,000 people. And I think we need to note, as I said, that the fiscal note doesn't include the costs of those 20 to 22,000 people who are going to be showing up with no insurance and what that's going to cost the CAT fund and the indigent fund and everything else, because, of course, there was no time to do that analysis. So it seems to me the upshot of where we're paying probably $3 to $4 million to create a new gap of 22,000 people is so far from what the voters voted for. We're just, it's not even a pale shadow of Proposition 2. Not even close. This is not in the universe of what the voters voted to do. They voted for no gap. They voted for clean Medicaid expansion with no extra millions of dollars being spent on this new force. Health and Welfare told us under House Bill 277, they're going to need to hire 22 extra people to create this new bureaucracy to enforce and police these work requirements to kick 22,000 people out of health care. Compare that to clean Proposition 2, where they would need 3 extra employees. So this is an extra 19 employees at an extra cost of millions of dollars so that we can create a new gap that will put our rural hospitals out of business. Again, this is just a stunning move, and it's a move that is opposed by every single healthcare organization in the state, and as well as IACI, and a lot of these groups on the list are not healthcare organizations. But I mean, it's remarkable, the list of those who oppose this. AARP, Cancer Society, Lung Association, the Disability Rights folks, the Hospital Association, the Medical Association, the Food Bank, the Education Association, the Firefighters Association on Mental Illness. There is hardly a group in this state that even touches healthcare in any way that isn't fervently opposed to this bill, as are the voters. So this is just phenomenally ill-advised, and there are ways to achieve the goals that we're trying to achieve here that are so much cleaner and so much cheaper. I understand that we want to encourage people to work. I totally agree. But we should look at the models that have worked, not the ones that haven't. Montana's optional work requirements have worked wonderfully and been very cost-effective. Why instead are we looking to replicate Arkansas's, which is now and the work requirements that have been challenged in federal court and that have proven costly and disastrous? I understand that we want to save our exchange and we want to keep people on the exchange. Why not seek a waiver that makes it optional and that lets people who want to stay on the exchange stay on the exchange, but for those 14,000 that aren't going to buy on the exchange, put them on Medicaid so that they're not stuck in a new gap? But I really want to address, and I could pick at this bill for a long time and all the little things that it does, and I've got a lot of issues on those, but I want to get to the big picture question here. And the underlying concept of whether it's appropriate and somehow effective to dangle this carrot and say, you people, and shake our fists at them and say, you should be working harder, you should be making more money, we're not going to let you have health care unless you prove you're working harder. I mean, at a baseline level, we've been doing that for 7 years. For 7 years, that carrot has been dangling. Because for 7 years, it's been the case that if these folks could just make a little more money, they would qualify for the exchange. And yet they didn't. They were still in the gap. It hasn't worked for 7 years, and it won't work now. We're not really doing anything different in this that's somehow going to magically get more people working and more people making more money that's going to solve our gap problem. And it's left us with 60 to 70,000 uninsured from the get-go, and I don't see how any of this is going to change. And it's driven our rural hospitals out of business. Because we may think we're shaking our fists at these people and trying to punish them and incentivize them, but it all boomerangs back on us. It all boomerangs back on the taxpayer, because at the end of the day, the hospitals still have to take these people, and we still end up eating those costs. So we're not shaking our fists at the people in the gap. We're doing it to voters and to counties. But I just want to add a final personal note, because I grew up below the poverty line myself, and it stunk. I can't even tell. I mean, I lived in a public housing complex where there were roaches out in the hall. We had our windows smashed because it was a kind of bad neighborhood. We, at one point, had to brush our teeth in the bathtub for the better part of a year because the landlord wouldn't come and fix our sink. I was mocked at school for having, yucky Salvation Army clothes. I sometimes would sit at McDonald's and hope that a manager wouldn't notice me and hope that somebody would leave their fries on the table so that I could eat them. Every single day came with a dozen new difficulties and humiliations. And I believe that poverty carries powerful disincentives on its own. And I don't believe that we need to layer onto that with, plus you can die of an avoidable illness. I don't think that's necessary. I think the people that are in this gap are probably there for reasons that we aren't going to fathom today. And punishing them with lack of health care is not going to add a better incentive to get out of poverty than they already have by just what comes with being in poverty. And so and I got to say, I had free government health care. My mom and I had free government health care, but never for 1 minute did we ever say, this free government health care is so great, let's just stay poor. This is awesome. No, that's not how it works. Poverty is terrible. It remains terrible. Every cycle, I go and I try to make a point of knocking doors in every single trailer park in my district because they don't have paid lobbyists to represent them. And I try to understand what they're going through. And poverty is every bit as terrible now as when I was there 30 years ago. And so I don't think we need to pile on. I don't think that's what the voters wanted us to do, and particularly piling on in a way that's so costly to the taxpayers. So I would really fervently ask for your no on House Bill 277.